Hi, everybody. Thanks for coming to our talk, and thank you, everybody online as well. And thanks to Code for asking us to come. So today, we're going to take you through a really nice project that we're working on around blended learning. We're working on transforming a medical degree for graduate entry students from what is typically a synchronous face-to-face program into a blended program. So what we're going to do is I'm going to set the scene for why we've done this work, or why we're doing this work, because it's ongoing. And then Matt is going to take you through what it looks like and what are some of the impacts that we've had on the staff and the students. And I'm going to wrap up with a bit of a summary for you. Okay, thanks, Matt. That's why I'm not doing it. Okay. So maybe I should do it. Okay. So I don't know why I put these silly photographs, but anyway, I'm Nick Fisher. I work as a lecturer in medical education in Queen Mary in the Institute of Health Science Education. This is my colleague Matt, he's an e-learning technologist. I've got about 15 years experience in online medical education. That's why I've got some grey hair. And Matt's got about 4 years experience, 2 years at Queen Mary, and 2 years before that at King's College. So we work in what is called the Learning Innovation Team. The Learning Innovation Team is embedded into the Institute, primarily into the medical school. And our role is to bring in new projects, new technologies, new approaches to learning. So we're looking at the sort of the typical ones like VR, augmented reality, AI, things like that. We're also looking at bringing in new forms of teaching, primarily around team-based learning. So this blended learning project is one of the number of projects we're working on at the moment. But if you just click on that, just sit there. So this is where we work. This is what we call this is the Garrett building. This is in London East 1. I don't know if anyone has ever been there, but it's right slap bang in inner city London. In the medical school, we offer a 5-year, we call it an MBBS for undergraduate students. We also offer what is called a graduate entry program, which we're going to talk about in a minute. And we also offer a physician's associate's degree as well, amongst a number of other programs. Thanks, Matt. So this is the Royal London Hospital. So this is right next to us. So we're kind of around there somewhere. So the hospital actually serves Tower Hamlets. So Tower Hamlets, we move on to the next slide. So this is Whitechapel High Street, just outside our building. So Tower Hamlets, as some of you may know, is what is regarded as probably, I think it's the second most deprived borough in London in terms of unemployment, social issues, poverty, child poverty, and so on. So there's a lot of deprivation there. I think it also 32% of the population is Bangladeshi Muslim as well. So it's an incredibly diverse population that we work in. A lot of our students come from that area as well. So a lot of them sort of we talked about earlier about commuting into to uni from home. A lot of our students do that. Thanks, man. So this is some stats from the university itself. So we've got in the overall university, we've got 170 student nationalities. 41% of our students are from overseas. 71% are from ethnic minority groups. 47% first in a family's entire education, and 93% of state school education. So that sets a scene for the project. Moving on. So let's talk a little bit about the program itself. So the program that we're actually blending is the what we call the Graduate Entry Program, or JEP. So we're working on the JEP Year 1. So we're blending the modules in the Year 1 program of the program. The reason why we've chosen JEP is for a number of reasons. Partly because it's a small cohort size. So we've got about 47 students in the cohort. So by contrast, in the undergrad medical degree, I think, well, 200-300 students in Year 1. So it just makes a lot of sense to have the Year 1 students. Also, in terms of their profile, they're sort of more mature students. Some of them come from work. They can kind of fit the profile for widening participation that we might want to extend to in the future. And also being sort of more mature sort of graduate students, they're more self-directed in their learning. So I think, in terms of adopting our blended approach, I think we've chosen the right audience. That's not to say we can't extend it along to the undergraduate program in the future, but we feel that this is the most appropriate program to work with. So in terms of JEP, so as I said, we've got 47 students, 61% is female, 31% is ethnic minority groups. That's quite interesting, right? The contrast between the JET program and the overall university. It's quite a difference there. 20% disability declared, which is quite relevant for discussion later. And 99% is home free status. So why are we doing this? The program itself has been funded by NHS England, which has been incredibly useful. So that's paid for our time and also for a project manager. So in terms of some of the imperatives that we're facing as a medical school, and a lot of other medical schools are facing currently, is the prospect of doubling the number of medical school places. There are currently, the NHS estimates there are approximately 112,000 vacancies in the health service, and that's set to double by 2036 to approximately 250,000. And also with the increasingly aging population as well, there's a lot of pressure on the health service. So one of the things they're doing is proposing is to double the number of medical school places. And as an inner city medical school, we've got a real problem with space. So just getting all our students together is virtually impossible. We have a real pressure on space for practicals, for lectures, and so on. So this is one potential way that we can get around that problem. Also, in terms of widening access and participation, we've talked a little bit about that already. The NHS is very strong on this in terms of ensuring that the people who work in the healthcare service understand the patients they're dealing with and reflect the local community, and also very keen to attract medical schools from what might be regarded as non-traditional sources. So this program is part of that overall initiative, and that's one of the reasons why we got involved with NHS England. Thanks, Matt. And also a key part of this is actually that there's been a fair bit of research around medical students and blended learning. And a lot of everything that we've done is evidence-based. And the literature does sort of show that blended learning, in terms of the medical students, has the potential to improve their learning outcomes and increase their engagement. Thanks, Matt. Okay, so I'm just going to hand over to Matt now.
Thanks, Nick, and hi all. And apologies in advance if I have to scurry at my notes. So we've been throwing out the concept of blended learning quite a few times, and I think before we get into what things look like, it's worth taking a second to think about what blended learning means to us. In its simplest term, blended learning is an instructional approach that combines in-person teaching with online learning. Prior to this project, it was the course was mostly very traditional, synchronous face-to-face learning where you sit in class, have your lectures. There's occasionally some online asynchronous activities, usually relegated to maybe like a pre-recorded hour-long session or maybe a quiz here or there. Even though this is an example of blended learning at play, what we wanted to do is we wanted to create something that went a bit deeper, that we wanted to find a way to adapt traditional in-person learning to the online medium. For us, blended learning isn't simply about having tools to support in-person learning that goes overlooked, but actually creating something that is teaching. So how do we do this? We come up with a design first. And one of the things that really influenced our design approach was Universal Design for Learning, or UDL. UDL, sorry, UDL centers all about creating accessible learning environments for people who have a variety of abilities, disabilities, and other characteristics. It also posits that if you are able to stimulate in your environment the effective, the recognition, and the strategic parts of the brain networks, then you will be able to create expert learners. So how do we do that? There are three areas. One is engagement. Engagement simulates the effective network of the brain. It's basically what creates our enthusiasm for learning. So an example of this would be having a lesson that relates to real world case studies or something personal within their life. Next. Representation is a way of simulating the recognition network of the brain, which is all about finding ways for learning to be accessible to you specifically. So one way of doing this could be having written guidance in addition to video guidance, or making sure that documents on a course page are available to be downloaded in a variety of accessible formats. And lastly, action and expression. This simulates the strategic network, and it's all about creating a variety of options for learners to express their learning. So that might be a quiz, it might be a forum, but having different methods for people to find ways to express their learning. So once we've created this, once we've taken these bits of UDL, these guiding principles on board, we decided on outlining a blended model that would have one fully asynchronous day. Students would have a fully asynchronous day on Monday that would be completely student-paced. That would have first chunk lectures. These are short bite-sized lectures that would be captioned and have PowerPoint presentations attached. They would have interactive activities which go hand in hand with the chunk lectures, and those interactive activities would often, as much as possible, relate to real-world scenarios and case studies. And lastly, in order to keep that flexibility, no live lectures or practicals would be scheduled on that day. While the rest, Tuesday through Friday, they would have the standard traditional in-person lectures, practical, and social activities. In addition, we've also redesigned the course pages. For one, we've now added a weekly tabular format where each tab corresponds to a week of content and is subdivided by the day, so that students would be able to easily intuit how to progress through their course. We've also added scaffolding or guidance text, which is text that one gives a bit of a narrative to each weekly content, along with information like how to engage with the particular activity, along with an area for frequently asked questions or people to contact if they need any assistance. And lastly, we've also thrown on some optional tracking so that students, if they want to, they can tick chunks of activities by day, and they get a little progress bar at a glance to let them know how far they've gotten through the course. So now that I've gone into what it looks like, I'd like to talk a little bit about our evaluation process and the impact of this particular project. So to get our quantitative data, we mostly have been relying on the in-module and the midpoint and endpoint surveys organized by the university. Additionally, there are some focus groups that happen towards the beginning and the end of the academic year is where we meet up with students to talk specifically about blended learning and get our qualitative data. And lastly, at the end, even though we're in the early days, once we have finished with the entirety, this entire academic year, we'll be using learner engagement analytics along with the data we've collected so far in order to make improvements in the future. So I'm going to share with you some of the quantitative data that we have so far. One is that over half of the students are at least somewhat satisfied with the asynchronous learning on the course. Okay, that's fine. We just go through. So most are satisfied with the amount of asynchronous learning, which is usually in this transform content, about 1 to 2 transform per week. 42% feel it's as effective as synchronous learning, and almost a little over a quarter thinks it's more effective than synchronous learning. I'm not sure what teachers would think about that. And then for the most part, it seems that most students found it easy to navigate the online learning environment. So from our focus group, we were able to pull a few key bits of qualitative information, which is one, we need a bit more consistency around the quality of these interactive activities. 2, there's not much options due to the nature of these asynchronous content to collaborate. They also want assessment on interactive activities that mirror their assessments more often, but at the same time, they do want a variety of activities. So it's going to be, it's all about finding that balance. And lastly, as much as they enjoy the Mondays to be fully asynchronous, they've agreed that 1 day is enough. And the last thing I'll share with you is the staff impact. The 3 key areas are, one, that staff, because the data is so small at the moment on how students are experiencing it, how this reflects on test scores, they're not yet convinced that the work that they're putting in to create this asynchronous content is worth their time. 2, this is very much a culture shift. This is not what staff, or especially academic staff, are used to dealing with. It requires a lot of pre-planning and a lot of change to what they normally do. And lastly, for staff who are completely unfamiliar with how to use the software to create this asynchronous content, it is quite a bit of a challenge. And it's often at the time where they're the busiest. So it kind of gets in the way of a lot of priorities that they currently have. Now I'm going to pass to Nick to talk about the future and what we've learned.
Okay, thanks, Mike.
No problem.
Okay. So I think the first thing to say is that we've actually successfully built it, which has been probably our greatest challenge in terms of the deadlines we've had, and we've had some amazing colleagues in the medical school who have worked really hard on this. And the pressure we've had in terms of the funding that we've received and delivering this has been tremendous. So we've actually built it, so we're really, really pleased about that. That was our first priority. And there are some good materials there as well. So when we talk to the students, there's definitely some things they really like, such as for example, with anatomy, they love the ability to interact with the human body and do some interactive exercises. And where the assessments are what we call authentic, i.e. they mirror their real life assessments, then they're really pleased with that. So they do love the Mondays. They absolutely love it. I did the focus group with them, and they say it gives us time to prepare for the rest of the week. It gives me time to sort of clear my head, get all the serious amount of work done they need to on the day. So big plus for Mondays. And I think what it's given us also is a sense of and we've not necessarily had this before, but we've had a much better sense now of how students interact with our materials, how they learn, and we're starting to create a stronger dialogue with the students in terms of co-creation of the content and the evaluation. So they're very much involved now. In fact, I had an email this morning from saying, when we do our next focus group, partly based on the fact they get an Amazon voucher, but they are very keen and they're super helpful and they're actually really engaged with the whole process. So I think that's been a real bonus for us. Thanks, Matt. Some of the challenges. Quality is definitely an issue. We've had to rush this. It's been a real challenge. So there are some quality issues around the quality of the learning materials. There's a few sort of niggly things going on there. So I think that's something we're going to have to really nail for next year. One of the biggest challenges is in terms of consistency, because there are two sort of approaches one could take with this. One approach could be that we create all of the materials, and the other approach is that we get our colleagues to produce the materials. We've taken the latter approach, partly for pragmatic reasons, but the problem with that is then you get a lack of consistency. And that's something the students came out really strongly about, was it the lack of consistency. They want to know what to do and when and how on those Mondays, because they don't have the sort of level of support maybe on a Monday that they do in the rest of the week. So that is a definite challenge that we're going to have to work on. Timelines, yeah. I mean, you know, our colleagues are used to working last minute. And then we try to bring in some best practice in terms of timelines, project management, and so on. Sometimes it's on deaf ears somewhat, and we have to do a lot of chasing. And it's also always a balance of working with colleagues who've got lots of other priorities, and then helping them with us as well. So has been a problem, which we need to address. And partly, yeah, ownership and roles are slightly murky in terms of who does what. So I think there was a temptation for us when we weren't getting the content on time to say, oh, well, we'll just go and do it. Which doesn't, in the long run, isn't sustainable, and doesn't teach people how to create those materials and design and develop those materials. So thanks, man. There's definitely a lack of focus on accessibility. Accessibility has come out in a couple of ways. One of the ways is in terms of captions. There are a lot of issues with captioning in terms of the automatic captioning isn't always very effective, and we do end up with some quite strange language. And there's a couple of other things that we didn't really address with the students in terms of how they work from home, and we're learning from them. So they're saying things like they want transcripts of the content, and we hadn't really thought about that, partly for time reasons. We also had comments from at least one of our students who have issues working from home because they may have to share a computer with a PC with their sister or brother, or if they live in an extended family, which is quite common with our students. There's a lot of noise, there's a lot of energy at home, and they sometimes find it hard to get on their own and their own sort of space to do that work. So that's been a bit of a challenge that we really need to get our heads around. But it goes back to what I was saying about how this has been such a valuable thing for us in terms of learning how our students actually learn, and what they need as moving forwards. Thanks, Matt. So in the future, so what we're going to be looking at is accessibility big time. So we've got to really focus on that a lot. There are various mandatory things that we have to be looking at, as well as just wanting to give our students the best experience that we can. In terms of helping our colleagues, I think we're going to carry on down this road of getting our colleagues to develop the content, but we need to give them more support. So we're going to provide best practice examples, and we've got some now because we've got them in place in the modules, and we've had the feedback from the students in terms of what they like and don't like. We're going to offer more training to the staff in terms of design, training, in terms of the sort of technical development training, because quite a lot of the content, we want to make it as interactive as possible, and then you need to be able to use the development tools such as H5P, which some people are really fantastic on and have some really great examples of interactive content, but then other people really struggle with developing content using those sort of tools. We're going to have a really thorough review of year one, just so we learn from all of our the past things, the things that have gone really well, things that haven't gone so well, to inform our future activities. So what we're going to in fact be doing is reviewing year one and then improving the existing content. That's going to be our focus for next year. And finally, develop quality guidelines in terms of best practice design, in terms of IP, things like intellectual property. I think there's a lot of murkiness around IP and so on. So I think we need to produce more guidelines. But this is all something that we knew was going to happen. And in fact, we've learned an awful lot this last year. So hopefully we can produce something quite effective. Great. In terms of summary,
we're kind of right up to time.
Right.
So very quick summary.
Okay, so this is breaking new ground for us. It's also breaking new ground in the medical field. I think there are. I understand there are medical schools who are going into blended learning, but there is definitely a need to do this. We've been through those needs earlier in the presentation. Student feedback has been largely positive. However, they do want improvements and they expect to see it. And really, really critical is not to underestimate the impact on the staff and the fact that this whole change thing has been a real issue for us. And that includes academic staff and professional services. And critically, is the importance of engaging with students. There's a big push in Queen Mary in terms of working with students in terms of co-creation and evaluation, and that's something that's really been super beneficial for us.